Hematopathology has become more and more complex, requiring multiple technologies including flow cytometry, molecular genetics, and cytogenetics combined with morphology to make a complete diagnosis.
Often the treating clinician may not know what tests to order, so that they order many things in order to cover all their bases.
Dr. Loken is the president and laboratory director of Hematologics, a hematopathology reference laboratory located in Seattle.
We use flow cytometry to define the composition of the specimen. We can identify each and every cell as it goes through the flow cytometer. We can identify whether it is of one lineage or another, and we can also identify whether it's normal or abnormal. We can do this for blood or bone marrow or tissue, and we can then characterize those cells, enumerate them, and so we know what is within that specimen. We then do subsequent tests to be able to identify the prognosis or maybe even monitoring treatment of that patient, but it requires our understanding of this composition of the specimen in order to interpret those results.
At Hematologics, we use cell separation and sorting strategies to isolate the appropriate target cell populations so they can be assessed by molecular analysis, microarray, and FISH techniques.
Dr. Barbara Zahentner is the director of molecular genetics at Hematologics.
Cell enrichment is essential to obtain the proper results for minor cell populations. This is especially true for the prognostic assessment of monoclonal plasma cells in patients with myeloma and MGUS. We have recently shown that patients with plasma cell and lymphoid cell populations expressing the identical monoclonal light chains are in fact genetically unrelated. If flow cytometry sees multiple cell populations, we can separate those and then analyze them and determine if they're genetically related. Cell sorting followed by molecular analysis can also be useful to confirm the presence of residual disease in patients with acute lymphoblastic leukemia or lymphoma.
Understanding the cellular composition of a submitted specimen is important for the proper cytogenetic analysis.
Dr. Christine Stevenson, Director of Cytogenetics at Hematologics, has more than 26 years of experience in cancer cytogenetics.
Culture conditions are extremely important for analyzing the cells. We need to know the specific cell of choice to be able to determine the type of culture system that we use. We are then able to get those cells to grow and divide. It's very important that we obtain this communication from the flow cytometry. This information that we receive allows us to set up the appropriate culture systems. And it's one of the reasons why our abnormality rate is extremely high, at around 30%. Our failure rate is also extremely low. Our state-of-the-art equipment with metaphase capture and digital analysis allows not only a faster time of completion of the test, but it actually also contributed to our success rate. This close interaction between technologies and staff is very important in providing answers for complex cases.
As a hematopathologist, my job is not only to look through the microscope at the specimens that we receive, but also to look at the information as it comes from other tests that are being performed on that specimen. And integration is not just cutting and pasting information from tests and sending out a final report. At Hematologics, we start the integrative process at the very beginning. As specimens are sent through the pipeline, information is communicated back to me by the staff, and depending on the findings, we decide how to pivot the testing so that we are getting maximum information on that personalized specimen, and we're also able then, with communication to our clinician clients, to cut off and not perform tests that are not necessary. So by having this communication, not only in our laboratory but with our clients, we're really able to give the treating physician the information that he or she needs, the most up-to-date diagnosis, the most information for prognosis, and sometimes even for therapy. This individual approach also allows us to come up with strategies for monitoring patients in subsequent episodes.
Monica DeBaca is a board-certified hematopathologist and serves as the Director of Hematopathology at Hematologics.
As the national healthcare goals of integrated, personalized, and economically efficient medicine were announced, we were pleased. We had met those goals long ago. It was the right thing to do. Going forward, we'll continue to raise the bar and tailor our practice to assure that from each sample, the treating physician gets the most diagnostic information, the most prognostic information, and the most risk stratification information so that he or she is able to give the patient the very best care possible. Because that's what every patient needs. That's what they deserve.
As the uphill fight against cancer continues, scientists who dedicate their lives to improving treatment can help level the playing field for a healthier, pain-free tomorrow. Learn more about Hematologics, providing critical information at a critical time. For more information, go to hematologics.com or call the number on your screen.